According to the National Institution of Mental Health, nearly 1 out of 5 adults in the U.S. alone struggle with mental illnesses. Some of those are just the diagnosed ones. Many teenagers and adults struggle with mental health issues, whether it be more common illnesses like depression or anxiety, or more life-altering illnesses like schizophrenia or being bipolar/manic. Mental health is a larger issue than people lead on. These issues need to be capitalized and taken more seriously to help stop the issue. According to the Causes of Mental Health Illnesses, written by Smitha Handari on June 30th of 2020, she asks, what are the causes of mental illnesses? Genetics are one of the major causes. Mental illnesses sometimes can run in families just like addiction does. Experts believe most genetic mental illnesses are linked in abnormalities in multiple genes rather than just a couple. That is the reason why some people inherit susceptibilities of illnesses and not actually develop the illness. Psychological and environmental factors are also a major cause. Factors such as childhood trauma, loss of a parent or sibling, neglect, divorce of parents or guardians, dysfunctional family life, and social/cultural expectations are just a couple of them. Experiencing these will most likely cause to some sort of issue in your lifetime. Depending on how seriously you take them or how you deal with emotions will determine if the illness will be acute or manageable and serious and life-risking. According to the University of Health Services, the lack of dealing with certain emotions can lead to a depleting mental health. For example, if you are in touch with your emotions and can deal with them well, you might be able to dissect your thoughts and deal with them properly. On the other hand, if you cannot do those things, you might lead yourself to substance abuse, self-harm, or illnesses such as clinical depression or anxiety disorder. Some common illnesses include clinical depression, anxiety disorder, schizophrenia, or being bipolar/manic. Most of these illnesses, such as depression or anxiety, the person that has those illnesses does not realize the issue. This can result in use of substance abuse, self-harm, over-undersleeping, and suicidal thoughts/actions. Seeing these things from a loved one's point of view can be extremely difficult. That's why if you recognize the symptoms, trying to get help for the person or just talking to them to see what you can do. The first issue I'll be dissecting is anxiety. According to Health Topics written by the National Institution of Mental Health Information Resource Center, people with anxiety disorder are most often excessively worried for more than 6 days out of 6 months. Some of the things you could be worried about are school, extracurricular activities, work, social interactions, and everyday circumstances. The fear that is induced from anxiety can take over your life easily. The symptoms of anxiety are feeling restless, easily fatigued, difficulty concentrating, being irritable, muscle tension, difficulty controlling feelings or worry of fear, and having sleep issues. Anxiety can form into a higher version of itself, also known as panic disorder. People with panic disorder have heightened symptoms of anxiety. People with panic disorder also experience panic attacks. The other illness I'll be dissecting is depression. Depression is the most common illness in the United States. It is a common disease, but a very serious one. Some symptoms of depression are persistently feeling sad or in an empty mood, irritability, feeling hopeless, guilty, or worthless, decreased energy or fatigue, difficulty sleeping, and thoughts of death or suicide. There are multiple different types of depression, including persistent depressive disorder, postpartum depression, psychotic depression, seasonal affective depression, and bipolar depression. Bipolar depression is different from bipolar disorder/manic disorder. The risks for the factors of the disease include personal or family depression history, major life trauma, stress, or changes, and certain physical illnesses/medications. Preventing mental illnesses can be hard if it is a family trait, but you can still do a couple of things if it is not. Here are some ways to prevent mental illnesses. Value yourself, take care of your body, surround yourself with good people, learn how to deal with stress, avoid alcohol and other drugs, and get the help you need. Valuing yourself and others is sometimes a difficult task, but making sure that the situations you put yourself in do not give you a large amount of stress or compromise your mental health. Eating nutritious meals, exercising, and getting enough sleep is important for your mental health as well. A major preventer and helper for mental health is to go see a specialist and get the help that you need and deserve. For young adults and teenagers still in school, it can be very difficult to deal with your mental health. Schools do not tend for their students' mental health issues due to the fact that it has not been capitalized on in the past. Most students with mental illnesses struggle to get out of bed in the morning or develop substance abuse to help cope with the mess of their thoughts and feelings. Many teenagers simply do not have time to deal with their mental health, so it gets pushed aside. Going to school, having extracurricular activities, going to work, doing homework, then spending time with family and friends is a busy day. Having too much stress on one person can cause multiple types of illnesses. Schools and jobs need to be more patient and understanding with their students/employees that struggle with mental illness. Mental health is a larger issue than people lead on, and these issues need to be more capitalized and taken seriously to stop the issues. Having knowledge about the topic can be useful to try to understand where people are coming from. Helping kids and adults with mental illnesses should be more important and more common.